This video is going to go over why knee slides are a brilliant movement to do if you are someone who is prone to having a stiff and/or painful knee or a knee that is arthritic. So let's get to it. Hello everyone, welcome back to another video. All right, so pain-free movement within the body. Pain-free movement on a regular basis is incredibly important for the joints and the soft tissues that surround those joints within our bodies. Now, without adequate, regular amounts of this pain-free movement, the joints in the body tend to stiffen up and actually break down and deteriorate at quicker rates. But of course, movement always needs to be pain-free, because if we're putting pain into the system, well, then we're not doing ourselves any favors there. But how do we wind up doing enough movement for a joint like the knee when it's stiff and painful and maybe hurts to do regular walking activities or other exercises in general? Well, if gravity and loading up our joints when we're walking or doing those activities is too painful, then a good starting point is to take gravity out of the situation and perform movements in what we call an unloaded fashion. So an unloaded fashion just means that gravity is eliminated from the picture and we can produce movement that helps maintain the health of the joints and the tissues around those joints without irritating anything in any sort of manner. So this is exactly where knee slides come into the picture in this case, but it's important to understand why this particular movement is so beneficial. So here we go. Here's your quick little anatomy and physiology lesson for the day. So the knee joint is what we call a synovial joint. Now this just means that the thigh bone or the femur and the upper shin bone or the tibia are surrounded by this fibrous capsule that we call the joint capsule. Now, inside the joint capsule is where we find a bunch of what we call synovial fluid. So this is a lubricating fluid that basically works to maintain smooth, gliding, low friction movement of the joint surfaces, which is what we call the cartilage. So each end of the bone has cartilage on it, and you can think of the synovial fluid kind of like oil within your engine that helps to reduce friction and keep things very lubricated. Now on top of that, the synovial fluid actually has a lot of oxygen and other nutrients within it, and that's how the cartilage or the joint surfaces wind up getting these substances and nutrients that they need. But if the joint is sitting still, then we're not getting a great delivery of the oxygen and nutrients that the cartilage and the rest of the joint needs. So I like to think of it like one of those snow globes that when you shake it up, the snowflakes kind of float all around the globe in the water or the liquid. And if you can imagine that the joint here, by moving it, is doing the same thing, well, now what we're doing is we're getting those snowflakes to float all over the inside of the snow globe, or in this case, the joint. And so it's really important to understand that cartilage by itself does not have a very good blood supply. So that's where we need to rely on maximizing the oxygen and nutrient delivery through the synovial fluid in order to give the cartilage the best chance it can at staying healthy. And so by sliding the knee back and forth, the joint surfaces now have much more ability to collect the oxygen and nutrients that they need in order to stay healthy. So hopefully you can see now why doing these knee slides in a pain-free manner are actually quite beneficial for maintaining the health of the knee joint. Now keep in mind, we're not trying to strengthen muscles or strengthen tissue. We're just trying to provide a better working environment to maintain and improve the overall health of the joint. So what I often advise to a lot of my patients that I treat in the clinic is to have them get in the habit of doing these knee slides on a regular basis whenever they're sitting down. So if you know you're going to be sitting down for long periods of time, making sure that every 5 or 10 minutes you're just performing a handful of slides can really do good things for your knees. And keep in mind that it doesn't take any special equipment to do these knee slides. Now you can use a dedicated exercise slider pad like I'm using in this video, or you can easily opt for something like a furniture slider pad, or even a plastic dinner plate, or a magazine, or a laminated sheet of paper, just something that allows your knee and your foot to slide freely against a carpeted surface. And if you're doing it on a hardwood floor or tile, for example, you really just need to use your sock. Now you always need to make sure that this is pain-free to do. There shouldn't be any pain with this. And as long as it's pain-free, you just use a range of motion that feels good for your knee, and you go at a speed that works for you. In terms of how much you do, you really get to play around with it, but it's very hard to overdo this movement. Especially if you've been sitting down for a long period of time, you might find that it's worth doing 20, 30, 40, or even 50 easy reps before you wind up standing up. And for those with arthritic knees, just getting in the habit of just doing a minute or two of slides a handful of time a day can really help to make sure that you're keeping that joint healthy. So there you go, pain-free, gravity-eliminated movement that helps to push oxygen and nutrients around the synovial fluid in order to make sure that your cartilage within your knee gets the substances that it needs. Now, the added bonus here is that if your knee tendon, which we call the patellar tendon, or the quadriceps tendon, are prone to getting stiff and achy, knee slides will work great for this too. So a lot of times if we have that kind of low-grade tendonitis, or what we more often now call tendinosis, either within the patellar tendon or the quadriceps tendon, well, that kind of low-grade gravity-eliminated movement helps to make sure that the tendon's not getting stiff and achy, because tendons really start to act up and get really grumpy if they're not getting adequate movement. So if you're prone to getting an aching patellar tendon or aching quadriceps tendon right at the top of the kneecap there, because you're not getting enough movement throughout the day, Try incorporating these knee slides a handful of times throughout the day and see if that helps the tendons to stay a bit happier by exposing them to more constant low-grade movement. Now, if you find the contents of this video to be useful, helpful, informative in any sort of way, hit that like button because that would mean a lot to me. And so everyone, you know how it goes. Keep looking after yourselves, keep looking after one another, keep making great things happen, and I will see you in the next video.